This is Scott Becker with a combined episode of the Becker's Healthcare Podcast and the Becker Private Equity Podcast. We have today with us someone who's a fascinating leader, the CEO of FastMed Urgent Care, Webb Golinkin. And Webb's going to talk to us about his growth of FastMed Urgent Care, how he got into the business, what he's most excited about, and a lot more. You've had a fabulous career as a leader. You've been the CEO of several different companies. Tell us about yourself and about FastMed.
Yeah, thanks, Scott. So pleasure to be with you today. As you mentioned, I've been the CEO of 5 healthcare and health-related companies over the past 35 years. But really over the past 20 years, I've focused on the so-called retail medicine space. In 2004, I founded a company called Ready Clinic, which is one of the first companies to put healthcare clinics inside retail outlets. And at various times, we had clinics inside H-E-B grocery stores in Texas, in Walmart stores in multiple states, Duane Reade stores in Manhattan, Walgreens stores in Atlanta, and then finally sold the company to Rite Aid 10 years later in 2014. And, it was a very rewarding but challenging experience to kind of help to put retail-based clinics on the map, if you will. We faced a lot of initial skepticism from medical establishment, from payers, from regulators, and even from consumers, who, didn't know that they could get high-quality health care in a grocery, big box, or drugstore. But ultimately, we prevailed because of high levels of patient satisfaction. And I'm proud that, at this point, retail-based clinics are a permanent part of the landscape. In 2017, after running Ready Clinic at Rite Aid for 3 years, and also a population health management company they had acquired called Health Dialogue, I joined FastMed as the CEO. And we built it to, one of the largest operators of urgent care clinics in the United States. We had 170 of them at our peak, and recently completed the sale of them about a month ago. So I'm the retired CEO of FastMed, and really more recently have been focused on the publication of my book, which was published last week under the Forbes imprint, called Here Be Dragons, and created a website and doing a newsletter and some blogs and podcasts, really to really engage in the dialogue about how we can continue to try to make routine healthcare more accessible and affordable.
So let me ask you a couple different questions, because I think for our audience, a couple of these things will be particularly of interest, and then we will talk for a moment more about the book as well. Webb, first of all, congratulations on your career and your leadership. Talk about the urgent care evolution. We saw this really get going years ago, went from about 3,000 to 12,000 urgent cares in the country over the course of several years. Now, God knows how many there are today. You probably do know it. God and Webb probably does know. But that had a huge impact on hospitals, health systems, doctors' offices. Also, in your doctor's office, that so we can get your appointment next Thursday, was all of a sudden, we're going to have sick hours. You can come in today, because they had to respond to this. What is urgent care, mental health care ecosystem? What does it mean to hospitals and health systems? That's a big part of our audience. Can you take a moment on that question?
Yeah, sure. Well, so Scott, I guess one thing is that, to me, retail-based clinics and freestanding urgent care clinics, fall under the same umbrella, if you will, of retail medicine. And, the basic goal was to make, routine, acute, episodic, and preventive care more accessible and affordable to patients. And as you suggest, they have had an effect on the rest of the healthcare ecosystem, because, patients have responded and did respond to the convenience and affordability that we offered. Having said that, over the course of both Ready Clinic and FastMed, we had joint ventures with, or strategic partnerships with, more than a dozen major health systems, because we realized that we needed to be part of the local healthcare ecosystem, because there were patients that we saw who had conditions that were outside of our limited scope of practice. And so, we always wanted to be part of the ecosystem, but felt like and feel like, we provide unique convenience and accessibility, almost as if we were a portal into the larger healthcare system.
But I think that complimentary point, Webb, is so well taken. I remember not long ago taking my parents to a local urgent care here. In our area, we've got Northwestern Health System and the North Shore University Health System, both really great health systems that have lots of urgent cares. Now, on some days, they are so crowded and that it can be hard to get into. But on one such day, we took my mom in, and it was such a fascinating thing to see the complimentary way in which everybody worked. Because the person, I forget where we were at North Shore, Northwestern, said, look, we're booked for the day and we close at this point, but not very far away, a mile away, is this urgent care, and they're taking people on. And that urgent care was a for-profit one. And it just reminded me that I think 10 years ago, we wouldn't have seen that type of cooperative type of thing where they felt comfortable looking at it as an alternative positive site versus something that was negative for the health system. So I thought that was just absolutely fascinating, and partly how a lot of this ecosystem has grown. So talk about that. I mean, it seems today competition, but somewhat cooperative, and not nearly as much as, oh my God, we're just in a war for every patient we could be in. More, maybe there's a war for staff, but not as much for people as it was at one time. But and does that resonate with you, or what is your sense of that?
Yeah, no, I think you're spot on, Scott. Initially when I started Ready Clinic, there was tremendous resistance from the medical establishment, if you will, because, they felt, I think, that, we might take a lot of their patients away. And then there were questions about whether we could provide high quality care in a retail environment. And on the latter point, the research showed pretty consistently that the quality of care we were providing within our limited scope of practice was comparable to, if not better in some respects, than was provided in alternative delivery outlets. But, we always wanted to collaborate, if you will, with other parts of the healthcare system for the reason that I suggested before, which is we had a limited scope of practice and we were seeing patients that had conditions that were outside of that scope, and we needed some place to refer them to. But initially, frankly, large health systems, didn't really want to play ball with us. And so we were kind of on our own for a while, but that's definitely changed. And, we've had very productive partnerships with large health systems and value those partnerships. And I think we fit into an overall system where we're not only more convenient for patients, but, it's also frequently the lowest cost site of care. And, we're a perfect solution for people with, relatively minor, conditions. And, that's going to help the efficiency of the system as a whole.
Let me ask you a different question now. Knowledge a little bit in our private equity audience, but our health system always finds this interesting too, at least generally. Private equity investment in healthcare. It seems like that periodically it's demonized by DC. Also, periodically there's blowups, like the Steward healthcare system is a major blowup right now. Lots of debt on a low margin business and some other collateral damage. But talk about, people talk about private equity as though it's a demon or the villain, but it helps to clarify to people sort of that private equity it's a financial source. It's not villain or not a villain. It depends on, like anything else, who the people are. But talk a little bit about private equity in healthcare and any thoughts you have on that.
Yeah, well, look, I think private equity plays an important part in healthcare. I mean, clearly the system that we have, great as it is in, taking care of particularly of people with, highly complex medical conditions, it's not sustainable in its current form. And it needed to be disrupted and continues to need to be disrupted in order to make it more efficient and sustainable. And, private equity is there to provide, seed capital and growth capital and to help new ideas, kind of get on the stage, if you will. And so I don't see private equity as being, generally speaking, a demon at all. I think it's an essential part of, what we need to do, or, where the funding is going to come from. And to some degree, the financial expertise is going to come from to continue to make our system more functional, more accessible, more affordable, and more efficient, so that it doesn't just keep growing, at a rate that's faster than the rate of inflation, which is not sustainable.
No, it really is. It's fascinating. You've worked with various different sponsors in private equity. Anybody that you'd like to give a shout out to that was a pleasure to work with, and anything along those lines you'd be willing to do?
Well, look, I don't want to single any firm out. Really, all of the sponsors that I've worked with, over the years have been incredibly supportive. Obviously, people or private equity firms have different amounts of resources, time frames, risk tolerances, and so forth. But in general, I found it to be, a pleasure to work with private equity firms. They provide, not only financial support, but, I think some valuable operational support in some cases as well. They have resources available to them. Many firms now have operating partners who can, help smaller companies get off the ground operationally as well as financially and grow operationally. Because, a lot of smaller companies that are private equity funded, don't have necessarily the management teams who have experience in scaling the business. And private equity can be very helpful there in many other ways. But also, I would say, Scott, that strategic investors have also played an important role in my career. And, more recently, Blue Cross of North Carolina has been a strategic investor in FastMed. They were a longtime strategic investor, actually, before I even joined the company. They were terrific to work with and, understood what we were doing and were very supportive of it and provided financial support, but also, other kinds of support as well.
No, thank you very, very much. And I'd be remiss if I didn't ask you to tell us a little bit more about the book and where people could find the book and so forth.
Sure. So the book's called Here Be Dragons. And, there's a story behind the title that you'll read in the book. But, basically, it goes back to the days, when I was starting up Ready Clinic and, had this crazy idea. And, a lot of people told me I was crazy and that, that it would never work. And that was kind of a Here Be Dragons moment. I had to decide whether I wanted to keep plowing ahead or listen to, all of the naysayers. But the book is really a story about the evolution of, my involvement in healthcare. I started out, actually, the first big thing I did was to start a cable TV network devoted to health called America's Health Network, which was ultimately sold to Fox. And we were in about 25 million households providing healthcare information to consumers. This was pre-internet, when consumers really couldn't get easy access to high quality health information. We had Mayo Clinic as a content provider, built a big studio at Universal Studios Florida, and it was a very, exciting venture. And then what I noticed along the way was that while consumers were having a hard time getting access to health information, it was made easier, considerably easier by the internet, but they were having a hard time getting access to routine care. And that's what gave me the idea of, hey, maybe we can provide care in conveniently located retail outlets. They're open 7 days a week, extended weekday hours. You're co-located with a pharmacy, so the patient doesn't have to make another trip. One thing led to another. So the book is about that. It then sort of travels to my experience at FastMed in freestanding urgent care and the challenges of operating the business during the pandemic, which was a very challenging time for all healthcare providers, and particularly for frontline healthcare workers. And I have tremendous respect for them and sympathy for them in a lot of ways. I mean, they were working long hours, long lines at our clinics before they even opened, sort of cranky, frightened patients. Our workers had to wear all this PPE, so it was very uncomfortable. Frankly, as everybody knows, a lot of healthcare workers, frontline healthcare workers, just got burned out and left the industry. And, that's a significant issue that I think the healthcare industry, has moving forward. And, there are all sorts of, crazy stories along the way. It was success, but it was a twisted path. Let me put it that way.
Yeah, no, but I'm going to ask you about one thing, because I had authored a book about building businesses, and one of the chapters I have in it is called "Don't Listen to the Naysayers." As an entrepreneur, take one moment in that concept, because anything you start, anything you do, there's going to be naysayers. And can you talk about that for one moment?
Yeah, well, I mean, that's absolutely true. and in some cases they have your best interests at heart, and in other cases they're just trying to protect their territory. And we had some of each. But I think what carried me through is I had a vision for what I wanted to do, and I at least wanted to try it out. And so we opened a few clinics, back in 2004, 2005, and we didn't know, what kinds of retail outlets, we would be successful in, or what locations would be successful, or a lot of unknowns. We had no contracts with third-party payers, but the thing I could see almost immediately is that the patients liked it. They liked the idea of being able to get in and out in 15 or 20 minutes. And that was what sustained me. And not just me. I mean, I think I had great teammates who were just as committed to the mission as I was. And so, it was what I saw in the marketplace, if you will, that, how it was working with our customers on the one hand, and the vision that I had and the mission that the company had to provide easier access to high quality, affordable healthcare. And that just, as long as we hung on to that, we were able to sort of drive through all the skepticism.
Fantastic. Again, Webb, what a pleasure visiting with you. Is the full name Webster original? What's the full name? Is it Webb like Webb Hubble? Is it Webster? What's the full name?
No, it's Webster. Most people call me Webb, and so I've just shortened that over the years. Only a few people who knew me way back in the day still call me Webster, but I have a website called Golinkin.com, where I'm doing some blogs and a newsletter that I'm starting to push out, and also sort of collecting articles on the theme of increasing healthcare affordability and accessibility. I hope will contribute to the dialogue of how we can continue to make progress with this great health system we have.
Fantastic. Webb, a pleasure to talk to you. I assume that the only people that call you Webster are people that have known you for a very long time, or people that are very mad at you. But I assume we'll stick to Webb. I want to thank you for joining us. We'll release this on both the Becker's Healthcare and the Becker Private Equity podcast. What a fascinating career. Congratulations on the book, and what a great pleasure to visit with you.
Scott, pleasure is entirely mine, and thanks for having me.